A 16-year-old patient with myelomeningocele presents with rapid-onset scoliosis and increased tone in the lower extremities. An MRI reveals a fluid-filled cavity within the spinal cord. What is the most likely diagnosis? A. Diastematomyelia. B. Syringomyelia, syrinx. C. Myelocystocele. D. Lipoma of the phylum. Answer: B. Syringomyelia, syrinx. Which of the following is the most common cause of latex-induced anaphylaxis in the Spina bifida population? A. Ingesting certain fruits, e.g. bananas, avocados. B. Skin contact with balloons. C. Mucosal exposure during surgical or urological procedures. D. Walking on rubber mats. Answer: C. Mucosal exposure during surgical or urological procedures. What is the Tower of London test or Wisconsin card sorting test often used for in the neuropsychological evaluation of spina bifida patients? A. Assessing visual acuity. B. Measuring executive function and problem solving. C. Testing for hearing loss. D. Evaluating gross motor coordination. Answer: B. Measuring executive function and problem solving. Which surgical procedure involves the creation of a continent urinary stoma using the appendix or a segment of the ureter? A. Mitrofanoff procedure. B. Mace procedure. C. Gastrostomy. D. Nephrectomy. Answer: A. Mitrofanoff procedure. In newborns with an open neural tube defect, what is the significance of low anal sphincter tone upon examination? A. It predicts future intellectual disability. B. It is a sign of a high-level thoracic lesion. C. It indicates involvement of the S2-S4 sacral nerve roots. D. It suggests the absence of a Chiari malformation. Answer: C. It indicates involvement of the S2-S4 sacral nerve roots. Which of the following describes spina bifida aperta? A. A skin-covered, hidden defect. B. Any open neural tube defect where the neural tissue is exposed. C. A defect involving only the cervical vertebrae. D. A condition characterized by excessive bone growth. Answer: B. Any open neural tube defect where the neural tissue is exposed. Which vitamin, when taken in excessive amounts, hypervitaminosis, can actually cause birth defects similar to neural tube defects? A. Vitamin C. B. Vitamin D. C. Vitamin A, retinoids. D. Vitamin K. Answer: C. Vitamin A, retinoids. A patient with spina bifida and a VP shunt develops progressive strabismus, crossed eyes. This is most likely due to a palsy of which cranial nerve? A. CN2, optic. B. CN3, oculomotor. C. CN6, abducens. D. CN8, vestibulocochlear. Answer: C. CN6, abducens. What is the purpose of standing frames for children with spina bifida who are non-ambulatory? A. To improve their reading level. B. To promote bone density and prevent contractures through weight bearing. C. To treat hydrocephalus. D. To decrease heart rate. Answer: B. To promote bone density and prevent contractures through weight bearing. What is the phylum terminale? A. The very top of the brain. B. A fibrous band extending from the conus medullaris to the coccyx. C. The nerve that controls the diaphragm. D. A protective layer of the heart. Answer: B. A fibrous band extending from the conus medullaris to the coccyx. Which of the following is a primary goal of bowel management in a child with spina bifida? A. To ensure the child has 5 to 6 movements a day. B. To achieve social continence and prevent constipation/impaction. C. To eliminate the need for dietary fiber. D. To increase the speed of gastric emptying. Answer: B. To achieve social continence and prevent constipation/impaction. Preconception folic acid supplementation is most effective if started how long before pregnancy? A. At least 1 month before conception. B. On the day of a positive pregnancy test. C. During the 2nd trimester. D. Only during the week of ovulation. Answer: A. At least 1 month before conception. What is the most common cause of morbidity in adults with spina bifida? A. Lack of vitamins. B. Urinary tract infections and renal complications. C. Childhood immunizations. D. Excessive height. Answer: B. Urinary tract infections and renal complications. Encephalocele is a neural tube defect characterized by A. Herniation of brain tissue through a defect in the skull. B. A split spinal cord. C. A fatty tumor on the lower back. D. Fluid in the lungs. Answer: A. Herniation of brain tissue through a defect in the skull. Which of the following imaging modalities is safest and most effective for screening a fetus for spina bifida during the 18 to 22-week anatomy scan? A. Plain X-ray. B. High-resolution ultrasound. C. PET scan. D. CT scan. Answer: B. High-resolution ultrasound.